All right. Well, good afternoon, everyone. Thank you for joining us today. Today's program is Let's Talk About Women's Health. My name is Hiral Shukla. I'm an outreach coordinator for Cancer Support Community Central New Jersey. And today's presenters are Iris, Novus Cooney, and Edgar from Horizon Blue Cross Blue Shield. So I will hand it over to them.
Thank you so much. Good morning, everyone, or good afternoon, I should say. My name is Edgar Osorio. I'm a community health rep for Horizon Blue Cross Blue Shield in New Jersey. Pretty much what I do for the company is I'm here as a liaison between the company and for you guys. So right now we're trying to do or spread the word is for everyone to get insured. As you guys know, with the pandemic still raging forward, a lot of people are uninsured at the moment, and they are missing out on the advantages that they could have on having Medicaid. Now, for those of you who are everyone's probably familiar with it, but I'll just give a simple refresher course. So Medicaid is a state government-owned insurance that pretty much is given for free to those who cannot afford their own insurance plan. Now, what I do for Horizon is I simply have a conversation with the individual, and I'll ask them based on certain qualification questions, whether or not they do qualify for Medicaid. And from there, if they do qualify, then I would be able to enroll them into Medicaid and then give them the information as far as their benefits and making sure that they know where their doctor is and where they could go if they're looking for any type of specialist. So I'm more of customer service, but kind of like on the road. Aside from that, what I also do is I do come in contact with a lot of community partners where we would share our resources. So if there's someone who's looking for food or has any type of food insecurity, then what I would be able to do is have them connected with our community partners in order for them to be able to access these type of resources at free of charge. So pretty much in a whole bubble, as a community health rep, I'm just here to help the individual and making sure that everything is set for them. And if they do need any extra assistance, whether it would become from health insurance, insurance in general, or even for life itself, I'm here as a liaison for them with the company. I also have my colleague here, Iris, who's a health educator as well, which she's going to be doing the main presentation. Iris, I don't know if you want to go ahead and take over.
Thank you, Edgar. And thank you for, again, having us come on and do our presentation. Good afternoon, everyone. My name is Iris Novus Cooney. I'm a community health education manager for Horizon Blue Cross and Blue Shield of New Jersey's under their government programs specific to Medicaid. My role is around creating, developing, and implementing health promotion and disease management, health education materials, presentations, professional developments. Around, again, prevention health, chronic illness management, and utilization of local resources. Today, I'm excited to talk about women's health. As part of my presentation, we'll be discussing prevention screenings, chronic illness management, nutrition, physical activity, and some mental health awareness. Upcoming in October is Breast Cancer Awareness Month. And I really love doing presentations, particularly around women's health, because every month we should be celebrating some type of women's health forum, right, with our health focus. But October is a particular month where we kind of redirect not only awareness, also self-care. Women really take on the role of not only managing and litigating their own health needs, but the family health needs, whether it's their children, their partner, their parents, family members, neighbors, friends. We really tend to take on more of a maternal role and navigating through health services for others, but we really need to centralize that and bring that focus also to include ourselves. So October, I find, is a really great month to remind women that they are important and valued enough that they should really take care of themselves and put themselves as a priority in order to serve their best self to take care of others, right? You gotta feed and fuel yourself and take care of your needs first in order to put your best self forward for others. So I'm just going to share my screen so we can get started on the presentation. Let's see. Okay, can everyone see my screen?
Yep, I can see it on my end.
Terrific, thank you. Let's do this. Let me go to the beginning. 1 second. It jumped up to where I last left out. There we go. Okay. So today we're going to talk about top health issues around women's health, nutrition and physical activity, mental health, and stress management. Some of the main health issues affecting women are heart disease, autoimmune disease, obesity, and depression. So heart disease risk factors is a major contributor of around women's health, and women tend to display heart disease symptom or symptomology different than it would appear in men, right? So not every heart disease is exactly the way the symptoms show up are exactly the same. So it is really critically important to kind of learn what as a woman, what your normal needs are, what your health guidelines are, so that as things change in your body, you can identify them and communicate that effectively with your doctors, right? So, and what I mean by that is that it's not always like massive chest pain, like in commonly known around heart disease. Sometimes it shows up as like heart or indigestion discomfort, persistent headaches or migraine, pain perhaps somewhere in the right side, but not necessarily like a chest pain. Or sometimes it could be misinterpreted as some type of anxiety level of discomfort in your chest area when it's really a heart condition. So we really need to understand what our healthy normal is, communicate those changes or what those within normal limit ranges are with your doctor, so that if anything changes, you can pick it up yourself and then bring it to your doctors for further assessment. So some of the risk behaviors around heart disease are cigarette smoking, poor diet, lack of regular physical activity, higher body mass index or overweight or obesity, which is a body mass index over 25 to 29.9%. Obesity, again, higher than 30%, or a family history of heart disease. Obesity is one of the main factors where it increases your vulnerability to other chronic illnesses. So having a higher body mass index automatically increases your chances of heart disease, autoimmune disease, cancer, diabetes, all of respiratory illnesses, all of these other chronic illnesses, your risk jumps dramatically just from an increase of a body mass index. Now, a body mass index is 30% or higher of what your normal or within normal limits are for the individual. There's a difference between being overweight and obese. Now, clinically obese means there are different factors that determines what your healthy weight should be, right? So it depends on your sex, on your height, on your weight, your age. You know, there are different factors that are contributing to what your healthy weight should be, right? Now, anything above 20 pounds of a healthy weight is considered clinically obese. Now, obesity is a condition, a disease like any other, okay? But also there's the added stigma, social stigma around, you know, overweight or obesity, right? But it's not a large number. 20 pounds is really not a lot. over your normal body weight. So think about that. If you're over 20 pounds over what your normal weight should be, it really does dramatically impact and increase the chances of other very preventable chronic illnesses. So keep that in mind as we, check our behaviors, right, around our nutrition, around our physical activity, around how we rest, right, if we're getting enough sleep, how we are decompressing, right, how we're managing stress around this, especially now in the time of a pandemic, right? So all of these factors really do impact how we maintain and manage our weight. But also how we maintain and manage our weight also impacts our risk factors for other chronic illnesses. So obesity complication factors tends to come from, lack of physical activity, definitely a family history, and unhealthy eating habits. Usually the combination really does negatively impact the individual, and it tends to promote any risk factors as they relate to family history. Family history, you can't help genetics, right? You're given that genetics from your parents, your mother and father. But once we know that we are predisposed to certain conditions from a family history, we know that our risk is much greater, okay? So knowing this, the conversations that you have with your doctor really negate what types of screenings you will need and how early those screenings should be done, right? So for example, if there is a family history of obesity, right? Both my parents were clinically obese. Their parents were clinically obese. The likelihood of I being clinically obese, it's much greater, right? So I have to understand that my behaviors around nutrition, physical activity, how I manage stress, how I deal with my mental illness will directly impact my decreasing my risk of falling into being clinically obese. Having a higher body mass index puts you at a greater risk of common health conditions, just like stroke, atherosclerosis, which again affects the blood vessels from long-term damage, heart attacks or heart failure, renal disease, kidney failure, right? And being overweight can lead to high blood pressure and related complications. Does anyone have any questions? If you have any questions, please post them in the chat box. And Edgar, I'll refer to you if anyone does have a question, or Haral. So some of the symptoms of obesity are increased sweating, weakness, not being able to cope with sudden activity, back and joint pain. Now, back and joint pain, as we get older, we do tend to suffer from joint pain, right? Our bodies change, and as we get older, we kind of have to adapt. But there are small, subtle signs that things are changing in the body. So what's important here is if there's vast change, even if it's small, but if there are changes happening to your body, the most important thing is for you to recognize them, right? And then once you recognize them, make sure that you're sharing that back with your doctors, right? We may not consider, excessive sweating as a problem, but it's really your body letting you know that something chemically, hormonally, something's off, right? And those are subtle clues that the body lets you know that something is starting to change and will likely need to be addressed, right? So make sure that you're recognizing if there are any type of these changes, you circle back with your PCP, your primary care physician, for further assessment. So common symptoms of heart disease are chest pain, jaw pain, shoulder pain, nauseousness and vomiting, shortness of breath, and persistent headache. Now, remember what I said, that in women, it tends to manifest itself a little bit differently than in men, right? So oftentimes, when you're feeling chest pain, right? We assume that the chest pain should be more on the top surface, right? But remember, your heart sits right in between your chest, like right where the rib cage meets, it's right behind it, slightly to the left, okay? Now, when we eat, our stomach is like right in that same vicinity, right? So if you're feeling any type of discomfort in this area here, you want to make sure that you're circling back with your doctor. Make sure that you're taking your blood pressure, you know, sporadically, not just when you see your doctors, but anytime you go to the, you know, pharmacy, or if you're participating in a health fair that may be offering a free screening. Even if you have a cuff at home that you could use, monitor your blood pressure and make sure you know what your healthy blood pressure is by your doctor, okay? Record that. Keep in mind that if there's any changes, again, that's a conversation you need to bring back to your doctor and let them know, because your body lets you know that something's off. And unfortunately, with heart disease, your blood pressure, you may be disclosing higher blood pressure or having like distress, but the symptoms may not show themselves until it's too late. So please be sure to check it often and in different scenarios, not just at your doctor's office. Take advantage of the free blood pressure screenings that are offered like by your pharmacist or in like local community events. Since COVID, those screenings have not been offered, but talk to your doctor about perhaps, depending on your risk, your heart disease risk, if you should get a blood pressure cuff for home use. Now moving on to common cancers among women. Breast cancer is definitely one of the most common cancers within women. Breast cancer, because there's so many early interventions and there's a greater number of mammograms being done at current times, there is a large number of identified cases in its early stages. So much of, even though there are a lot more women that have been diagnosed with breast cancer, they are finding them much sooner in the disease process, and then being able to treat those women earlier, right? Because you want to catch it in its earliest form in order to have the most options in treatment going forward, right? So it's like a double-edged sword. Yes, there is a higher number of women and men. You know, there's a small percentage of men that do get breast cancer as well, but there are a higher caseload of women with breast cancer, but it's because of the technology and the interventions, screenings that are done preliminary that are much more accessible now, that the increased number of women are found to be diagnosed, right? But with that, once you do catch it earlier, we are able to do more aggressive interventions and more of a variety of options as to what that intervention may look like. Another common cancer is colorectal cancer, cervical cancers, and lung cancer. Colorectal cancer and cervical cancers are extremely preventable, right, with early intervention screenings. Again, with colorectal cancer, if you have a family history of colon cancer, this is definitely a conversation that you need to have with your doctor to see what generation it is that had that was diagnosed with colorectal cancer. Was it a sibling? Was it a parent? Was it a grandparent? And then they can determine, depending on the age of their diagnosis, how soon you should have a baseline colonoscopy for yourself. Now, colonoscopy is the early intervention screening method for identifying polyps or colon cancer. So again, this is a larger conversation that you would need to have with your doctors, but this is definitely something that, if planned accordingly, can really save your life. cervical cancer is definitely a disease that's linked with the HPV virus, and currently there is a vaccination that is available to the public, and it's recommended that they provide that vaccination before being sexually curious. So they're recommending that this specific immunization be initiated anywhere from between the age of like 10 and 13. And they are making it available in the early 20s population as well. So this specific vaccination is relatively new, not really. It's been around for about 25 to 30 years, but the last 10 years, I would say, it has there has been a lot more education around the HPV vaccination, and also directly linking it to cervical cancers and the reduction of cervical cancer from having this vaccination. So I would definitely encourage folks to encourage their loved ones to please speak to their doctors about the HPV vaccination to reduce their likelihood of HPV-related cancers. Among them, many lung cancers, cervical cancers, esophageal cancers, or oral cancers have been linked directly to the HPV virus. So this is something that can be very preventable, especially with the younger population, with the help of a vaccination to reduce the risk of these specific cancers. So early screening, again, the earlier, the better. And it's, again, a conversation that you can plan this out with your doctors as far as when you should have your screenings for breast cancer. Clinical exams performed by a healthcare provider. So when we go for our annual pap smears, they tend to do a physical exam where they assess the breast and the lymph nodes area, and also checking your vaginal health, right? So as part of this physical examination, the next step over would be a mammogram. And a mammogram is an X-ray image of the entire breast and then certain segments that go like behind the breast and underneath the armpit where there are large lymph nodes. And then another piece is the self-exam. No one knows your body better than you. So understanding what your health is, your measure of health, because every woman's breasts are different sizes, right? Not everyone has the same breast size. They may have different, skin colors, and everyone's breast is unique to them, right? But you should know what your measure of breast health is, so that you can identify when something changes and needs to be addressed. And we'll talk a little bit more about self-assessment. Going back to common cancers among women, we talked a little bit about the HPV, the human papillomavirus. And if you look at the image in front of you, this is your cervix. And when they do a pap smear, they take a tiny little piece of tissue from this region, and they test it under a microscope. And what they're looking for is abnormal cell growth in the cervix area. It tends to HPV tends to manifest itself, and in the early stages, it like colonizes and grows. But once you get to this phases, like the early and mid stages, then you start to experience much more physical symptomology as well. This is completely treatable and preventable just by going for your annual pap smears. Now, the regimen has changed. If a woman has not displayed a positive pap smear, the doctor may deem that specific patient does not need to have it every year. However, every practitioner is different, right? And depending on the woman and the woman's medical or family history. So again, this is a conversation that needs to be had with your gynecologist to see what they're comfortable with what they feel your level of health is, right? And if you individually need to have that specific test, the pap smear test, where they take a little piece of tissue from your cervix and evaluate it under a microscope every year. Now, just because the doctor may deem that you don't need a pap smear every year, doesn't mean that you don't go for a woman's health checkup. You still have to go every year where they do a physical evaluation, right? Where they do an internal check and an external check of your female reproductive health. Any questions so far? Again, I encourage everyone to talk to their doctors about the HPV vaccinations, and especially for members in your family that have young children, there is this vaccination available for both females and male, that they should definitely have a conversation with the pediatrician as to how they feel about the HPV vaccination and if it's a good recommendation for that child. So another common cancer among women is colorectal cancer. These precancerous cells that line the colon, the wall of your colon are called polyps, and they're irregular cells that build up over time, okay? And if not identified early in its disease process, can cause substantial damage to not only your organ, your colon organ, but also transmitted to other organs as well, or the term metastasize, where the cancer moves from one vital organ to another. Colon cancer is definitely very treatable if you catch the anomaly early. So the colonoscopy is a tool that is used usually under sedation, and they go rectally and look at the inside lining of your anus and into your colon. And they go up to like a certain level of your colon in order to look at the lining all the way around for these polyps or abnormal cell growths. If the doctor comes across these polyps, they take that polyp and they test it underneath the microscope, again, to see what type of abnormal cells, if it is a cancerous or non-cancerous cell, right? And then also what types of interventions need to be had afterwards. Are there any questions? I thought I saw up front.
I have one on the chat. There was one that says, doesn't overweight as well as obesity increase the seriousness of COVID-19?
I'm sorry, ask that question again. You got cut off a little bit.
So I think doesn't overweight as well as obesity increase the seriousness of COVID-19?
Yeah, that's a great question. Okay, so folks who are either overweight or clinically obese, their risk factors for COVID-19 related ailments are increased, because by being clinically obese, it automatically impacts your immune system, okay? So if your immune system is already compromised by being clinically obese, that puts you at a greater risk if you do get infected, of how your body's gonna respond to the virus. So yes, being like overweight or especially clinically obese, it already puts you at a higher risk for conditions, right? And it negatively impacts the normal function of your other organs. But if you are exposed to specific bacteria and viruses, it does negatively affect how your body will respond to it. So yes, this is why folks who are obese are at a higher risk of exposure to the coronavirus.
I have another question.
Yes, Iris.
I was told by my gynecologist a few years ago, because of my age and no history with cervical cancer, no family history, that I no longer needed to have a pap smear, period. And I was under the impression I no longer needed to get an internal exam annually.
Okay.
So
And-
can you confirm, are you aware of that? Do you have any opinion about it?
So every case is individual, and there are some doctors, gynecologists, that feel that if they have an extended amount of history with you, right? Since we're talking about you, Iris,
Right.
and your smears have come back negative, right? If they feel that you no longer require it at this point, that's fine. However, I do think that having annual women's wellness checks with your gynecologist is still a good thing, right? Because they do an external assessment, right? Where they look at your breasts, they look at the outside of your, vaginal anatomy, and then they do an internal text, like an internal assessment as well, right? So I would err on the side of, at the very least, still having that assessment, even if they say, come back every other year. You can kind of, again, work that out with your doctor and see what your comfort zone is. If you don't have a history of like urinary tract disease or abnormal discharge, any changes in your discharge color, odor, pressure, any changes in your reproductive health, I would alert that to your gynecologist and definitely set up a schedule if you're healthy,
Okay.
where you're comfortable and they're comfortable.
I understand that. I do continue to take mammograms.
Good.
They're
Excellent.
required.
Are you so you don't have a family history of cervical cancers?
No.
Okay.
No, and I've been seeing this gynecologist for over 30 years until she retired 2 years ago. So now I don't actually have a gynecologist right now.
Oh, okay. So I would, so my recommendation is, since your previous gynecologist is since retired, I would definitely find another one, right? And just have, like, go in for your regular checkup and have this conversation so that they're comfortable with the assessment, and most importantly, you're comfortable with the assessment.
Okay, thank you.
You're welcome. Are there any other questions, Edgar?
Nope.
Okay. Thanks for your question, Iris.
Thank you.
You're welcome. So cancer of the colon and rectum, right, specifically, and these precancerous cells, if identified early enough in their disease process, they're, again, the interventions are much more broadened, and the earlier that you detect the pathology, the sooner you can have medical intervention in order to get ahead of it before it causes more extensive damage to the organ or extensive damage to other organs, right? So early detection really does save lives. So common lung cancer is definitely associated with smoking, right? And again, it's also been closely related to the HPV virus, right? As it is with esophageal cancers and oral cancers, certain types of colorectal cancers and reproductive cancers have been tied back to exposure of HPV. So it can be a mix of, behaviors around like smoking cessation or just exposures to the HPV virus. I would definitely, again, have a plan, a call of action, especially for folks that have respiratory diseases like chronic bronchitis or asthma, or any type of respiratory condition. Definitely have a guided plan with your doctors as to specific x-rays that they may want or other assessment tools as part of the screening process. So autoimmune disease or thyroid disease develops when your immune system, which defends your body against disease, no longer recognizes healthy cells. So when you think about your immune system develops almost like soldiers that go out into the body and identify foreign, bacteria and viruses and defends the body against that shock. But over time, if you have either one chronic illness, or a combination of chronic illnesses, it directly impacts how your body responds to infection, right, to bacteria and viruses. This is why it is critically important to make sure that not only are we feeding ourselves and we are moving in a healthy rate, right, because it's conducive to how your body responds to, germs and bacteria and viruses and how they defend themselves from it. So make sure, again, that when you're speaking to your doctor, that they are, they normally check for your immune health, but that they explain to you what it is that they're looking for and where you are in health so that you have a better understanding as to how you can maintain it. So common autoimmune disease are diabetes, rheumatoid arthritis, lupus, among others, right? Which directly impacts how you fight off infection. Diabetics, one of the reasons why diabetics are such a vulnerable population to other common illnesses is because diabetes not only affects how you process sugars in the body, but it also negatively impacts vital organs slowly and over a long period of time. So keep in mind that not only balancing and managing diabetes, it's also making sure that you're keeping the other organ functions up to par, right? And it increases your overall wellness and how your body responds to common, germs and microbes, right? So be sure to have this conversation, especially for those of us that are in that higher risk factor of developing diabetes. Any questions so far, Edgar? Or are we still good? Harrell, we're good?
We're still good so far.
Thank you. Okay, so symptoms vary depending on the disease, right? So rheumatoid arthritis tends to manifest itself in the joints, right? Joint pain and swelling, muscle pain and weakness or tremors. Lupus manifests itself mainly a reddish, pinkish hue that goes around the face, around the nose area into the cheeks. Again, your skin changes with time, especially as we age, but all of these very mild symptoms may not always manifest it themselves. So the best way to identify if there's any type of autoimmune response or differences is to check in with your doctors for well checkups every year. And during this visit, the doctor does do a full comprehensive assessment of your medical history. They also do a blood panel where they check specific enzymes and organ function and hormone balances and cholesterol and all of this, all this much comprehensive blood assessment. But they can also compare your analysis from year to year to see if there's any significant changes. Again, talk with your doctors to make sure that your immune system health is up to par, especially as we age, to make sure that you're getting ahead of it. Physical activity and nutrition. So when I do my nutrition demonstrations, I always say that your first medicine is your food, right? How we fuel ourselves directly impacts how our bodies respond to it, how well we're presenting valuable nutrition in order to keep our organ function and for us to, keep healthy and thrive, right? So our first medicine really needs to come from our food. Mixed with food is proper hydration, right? We need to hydrate sufficiently, not only to process the food that we eat, but also to help eliminate it, right? Our bodies use food as fuel, right? That fuel is then processed, but our bodies also tend to collect them and as waste, right? So we need to eliminate that. And part of helping proper elimination in the body is making sure that we're hydrating enough for us to do that. So make sure that you're drinking sufficient water throughout the day, mix in with a nice balanced meals in between. So physical activity is definitely something that women should integrate on a daily basis, ideally. Anywhere from 30 to 60 minutes is always great. It's not only great for your joint health, your bone health, your organ health. It's also really good for your mental health too. Moving gets, the juices flowing in the body, and you're also releasing certain enzymes, chemical enzymes that are essential for your mental health. So walking or riding a bike or dancing or playing sports, joining a gym. Sometimes, like at this period, gyms are a bit sketchy, but if there's tons of YouTube videos that offer, routine exercise that you could do right from your home, and they're, completely free and available to everyone. Find what works for you and what you're more inclined to do, and make it an integral part of your daily routine. And that may look different for different folks, but as long as you're moving, right, that's what's most important. So for folks that perhaps, especially now that the winter is approaching, that really don't want, if it's too cold to go outside for a walk, perhaps, doing a couple of flight of stairs inside, your home, or just like walking in place while you're watching the news. There's so many things. There's like yoga and Pilates and like stretching and all of these different types of exercise regimen. Find the one that's right for you and try to incorporate them daily. But the conversation, if you have never exercised regularly, I would definitely have a conversation with your doctors to make sure that you discuss with him or her what you're thinking of doing and that they're agreeable to this. Because you don't want to go from like 0 to 100, right? Especially if you've never had a daily exercise regimen and you have other chronic illnesses. So make sure you have this conversation with your doctor so that you both can work out a plan that best fits your needs and keeps you healthy. So managing your mental health and stress management really is an integral part of women's health. I always think of individuals' health as 3 pillars, right? There's the physical health, the mental health, and the emotional health, right? And all 3 are vital intersections that help one another. So if one is off kilter, it will negatively impact the other 2. Everyone has stress, and especially now during a pandemic, we are all experiencing some form of trauma around, COVID-19, whether a person has been infected and went through the disease process, or they've lost a job, or their family members have been negatively impacted, or they lost a loved one. We're all experiencing this, and it's not just like unique to New Jerseyans or to the United States. It's a global pandemic, right? So acknowledging that we are all kind of walking through this experience together, and how it impacts us may look different, but also how that trauma impacts us individually may look different as well. So if we can acknowledge that, yes, this is a traumatic experience and we are experiencing this together, then it empowers you to take steps to address how to address the trauma itself, right? So when you're thinking about your mental fitness, also know that depression is a medical condition, right? It's a medical illness that can be treated. There are a vast number of mental health professionals that are completely equipped to address and help you work through the depression, right, or any type of other mental illness. And it can be through counseling therapy mixed in with, you know, medically prescribed medications in order to regulate your chemistry. So understand that it could be a combination of the two, but counseling is a really important piece of that process. So there could be individual counseling, there could be group counseling. It may look differently for everyone. And also, you know, when you connect with a mental health professional, you really have to find the right person for you. So be particular. If you prefer, let's say, a woman versus a man, if you prefer group session versus individual counseling, all of these questions are completely legitimate. Find what works best for you, but the most important piece here is to address the mental illness and address it early because it's totally treatable. And we as a society have come a long way to destigmatizing mental illness, but we still have a ways to go. So I think, you know, counseling is like an essential thing. I personally have benefited from it. It's definitely something that we all need can use to kind of grow and develop and stay thriving. But it's not something that should come with shame, right? Everyone has a different, goes through different experiences, has different traumatic experiences throughout their lifetime. There's no shame in seeking help to address a concern. So talk to your medical doctors, your primary care physicians. As part of their assessment, they are integrating a mental health assessment tool too. They tend to ask you questions around like your sleep patterns. Do you feel unmotivated? Do you feel like you sometimes may want to hurt yourself? Like there's certain specific questions that they ask around mental health. And it's to identify them and also direct patients to the proper mental health counselors to address the issue if it does arise. So please reach out to your PCPs or your insurance, whoever your insurance carrier is, and ask to speak to a case manager or a nurse if you have specific questions, especially around mental and behavioral health. So some of the signs of depression are, you know, mood swings and irritability, anger, lack of energy, negative effects in a person's sleeps, headaches, anxiety, attacks or disorders, increased blood pressure and cholesterol, which puts you at a greater risk for heart attacks, reduced ability to fight and recover from illness like common colds, stomach cramps, nauseousness, and aches and pains in the body. Harel, are there any questions currently?
No, there wasn't a question, it was a comment that I
You can share. You want to share?
Yeah, so Carol suggested that local libraries and healthcare systems offer innumerable Zoom presentations and anything and everything related to exercise programs for all ages. So that was just something that I shared with the group.
Thank you. That was Carol?
Carol DiMartino, yeah.
Awesome. Thank you, Carol. Was there another comment?
Anytime.
No, that's it.
Okay, terrific. So depression is a serious mood disorder that affects how you feel, think, and handle daily activities. It is completely something that could be treatable. And again, with the proper mental health provider and mix in with your PCP if they need to indicate prescriptions to help you get through this. It's something that's completely treatable and can be addressed early. You don't want to, if something has changed, especially with your mental health, you want to make sure you address it early. It's just like any other, ailment, like, cancer or diabetes. The earlier that you can, screen for it, detect it, identify it, plan for it, and get the interventions going, the better off you are getting on, out ahead of it so that you can manage it and you could still live well and thrive. So there are a variety of treatment options like medication and support groups, talk therapy, and working closely together with your primary care physician in order to develop a plan that's right for you. So again, eating right and physical activity equates to a healthy lifestyle. Remember that your food is your first medicine, so please make smart choices. And when I say smart, that means not to deprive yourself, right? You could still indulge in, every once in a while in some of the foods that may not be as healthy, but make sure that the majority of the food that you're putting into your system has a vast variety of nutritious value, right? So plenty of fresh fruits and vegetables in your diet, lots of hydration, lots of water, and making sure that you're moving effectively. Be mindful and intentional of how you're moving your body, because as you get older, your joints, your body changes naturally, right? The more you use it, the better equipped that the body is to handle those changes. So make sure that you're really intentional about, like, let's say going out for a walk for 30 minutes, making sure, I'll take the steps, I'll do a couple of steps, 5 steps up and down for a couple of times during the week, right? Just to get some extra steps in. And this does not mean that you're running, you're sprinting up and down the steps. No. Just doing a flight of steps, nice and easy, you feel your blood pumping and your breath getting labored, right? So that means that your body is working extra hard. You are reminding your organs, your muscles, your joints that you're still alive and you still want it to, work and function properly. So make sure that's showing them a little bit of love, even though, while you're doing it, you're uncomfortable. So making sure that you're integrating fresh fruits and vegetables, whole grains, and then low-fat dairy products. Make sure that you're mindful of the types of fats that you're putting into your body. Mix in with a lot of hydration. Nothing replaces water, so drink plenty of it. Get rid of the sugary drinks. They really have no nutritional value. So hydrate with plenty of water, mix in with healthy food options, including lean meats and poultry, beans, eggs, and nuts, as long as you're not allergic to it. And be mindful of the amount of saturated fats, trans fats, cholesterol, salts, sodium, and excess added sugars in your diet. Always remember to eat healthy, exercise, and get enough rest. I can't stress enough how sleep is essential for the body to recuperate itself. While you're sleeping, your organs are regenerating for the next day, but your brain is like in overload. That's when it does the most amount of work, is when you are sleeping. So also be intentional with your down period, right? Make sure that you're easing into sleep by not having distractions like a television that's on, or, any type of like distraction. Your body is still in tune to whatever it is that's going on around you. So be intentional with saying, this is my quiet time. This is my restful time for me to, energize, right? Refuel myself. This is part of self-care. Get the health tests and screenings that you need. I can't emphasize that enough. Your doctors are there as part of your healthcare team, but you are the driver here as the patient. So I always encourage folks to ask questions to your doctors. You know, doctors and nurses and their healthcare team, they're human beings too, right? But you have every right to question and probe more for more answers and really develop a plan that's right for you, right? In your healthcare journey. So make sure that you're really speaking up. And if you don't have the right answers, or you have, you know, if you need more of an understanding of whatever the regimen is, make sure that you are seeking those services around you to provide those, that guidance. So call your insurance coverage and ask them, you know, I need to speak to a nurse because I am not fully understanding what's the recommendation by my doctors, or I have other questions. Make sure that you're using that leverage. Make sure that you're taking your medications as prescribed by your doctor. Remember that a person that's prescribed any type of one individual medication or a combination, it takes time for the body to assimilate and regulate itself. And during that time, the body may respond differently. So be patient with whatever recommendation that the doctor prescribed and you agreed to. Be patient, know that it is a process, and the more compliant you are, the closer you are to where the end goal is that you decided with between you and your doctor. Okay, so make sure that you're taking your medications as prescribed. Please keep up your vaccinations up to date. Talk to your doctors and make sure that your vaccinations are current. Many folks are very reluctant to seek medical care in the time of the pandemic. I encourage everyone to please call your doctor, make sure that you are up to date with your well checkups, up to date with your vaccinations, up to date with your blood screenings or any other health screenings that are necessary, because right now there has never been a more important time to stay healthy, right? If you're healthy, we want to keep you healthy. And by speaking to your doctors and seeing your doctors and making sure that you're getting the proper intervention screenings early is only going to help keep you healthy. So please schedule your yearly wellness checkups for both your internal medicine doctor, your PCP, and your gynecologist. And talk to your primary care physician with any specific concerns that you may have. I'm going to stop sharing my screen now. And I'm going to open it up to any questions or comments to the group.
Thank you, Iris. I'm going to launch that poll real quick, and then we can address any comments in the chat. Hi guys, if you can answer the survey really quick, I would appreciate it. And if you have any additional comments, either feel free to unmute yourself and ask any questions, or you could drop it in the chat and I can read it, whatever is easier. Iris, I'll let you know as soon as the poll is over.
Sure.
Dominique says, great presentation. I agree. Thank you so much.
Thank you, Dominique.
And Kendra as well. Okay, I think we're good. End it in a second. Oh, I think people are still commenting, sorry.
It was an excellent presentation.
Thank you.
Thank you, Iris.
Dominique has a question. What foods would you recommend for people who experience chronic tiredness?
Oh, good question. So I would first default to your doctor to make sure that you're identifying what it is that's causing the fatigue, right? If you need specific assessment. Two, I would definitely integrate more hydration, right? Because if you are dehydrated, that means that your organs are working harder to process and do their normal function. So hydrate. I would definitely hydrate more throughout the day. And also I would speak to my doctor about like specific foods or connecting with a nutritionist, because everybody's chemistry is a little bit different, right? So you may of nutrients to offset that fatigue, and make sure that you're, you know, sleeping enough. Maybe you need like specific meditation practices, a certain amount of sleep during the evening, but also during the day, kind of like breaking up any shutting off screen time and being intentional about it. Perhaps incorporating physical activity that helps both stress management and the physical activity, like a yoga or a Pilates or meditation. Yeah, I would narrow it down to that. Like if you're fatigued, find out what's going on internally, right? Go to your doctor, make sure that's addressed. Hydrating, hydrating, hydrating. And make sure that your diet is providing the proper nutrients that your body is seeking, because your body's telling you that something's off.
I couldn't agree, Iris. You know, I suffer from PCOS myself, and so I've been on this journey of trying to figure out what I can do to all these symptoms that all of a sudden I feel in my adulthood. And I've realized that our dietitians are so underutilized, and there's so many more tests that they can do internally. A lot of the times I know, you know, with physicians, obviously they're busy, they have a lot of patients. I'm sorry if I'm breaking up, I'm sorry.
No, it's okay.
But yeah, definitely looking into your plans and going to see a nutritionist. You know, a lot of it is now covered through insurance because with women, our hormonal changes have a lot to do with it as well. So Dominique, I would definitely also, like Iris said, internally, you know, gut issues, making sure we're taking the right probiotics, especially for women.
Yep.
There's different probiotics for women versus men. I didn't know that, but a lot of women's, finding a dietitian that specializes in women's health that deal with hormonal changes and reducing stress in women has definitely been a number one thing that I've learned along the way. So, and then
yeah, I stay pretty hydrated throughout the day. I went to my doctor about it, and I got my blood work done, and everything was normal. The only pills that I take are vitamin D and iron because I am anemic. But I don't like. I think my doctor is not the best because like he in the certain things, and then he's like retracted what he said, and I'm just like, what are you doing? So.
Yeah, so I totally understand. I totally get what you're saying. And then I know, especially dietitians do certain tests to test the hormones, only because blood work doesn't show all the panels that you would do. So seeing a specialist definitely helps versus just seeing a primary.
Yes.
And then, like Carol says, you can definitely utilize the ShopRite dietitians as well. But I definitely think look into your plan and see what's covered, and try to see a dietitian specialist. They do definitely, because they have tests that you could see and test your cortisol levels, right? Because cortisol levels tend to rise due to your stress levels. That could be one of your reasons. Androgens in women, it's the opposite effect. If we have high levels of testosterone, you tend to get from our, it's called the adrenal fatigue. So all those things, a regular doctor won't check for you unless, again, you don't receive any guidance on your own. That's something you just also have to do, right? Like self-education.
Yeah, I tried a plant-based diet and it was terrible.
Dominique, have you tried reaching out to your insurance company? Like what insurance company do you have?
United Healthcare, which is soon to change because I'm changing an open enrollment. But yeah,
Okay.
I can look into the dietitians. Like I've tried to like, I guess you could say self-medicate. I've tried to do the plant-based dieting thing. That was terrible. Made me tired all the time. But I think it's stress and probably my sleeping patterns and also my screen time. Because, you know, Hulu and Netflix are just like, you get upset.
It is hard to put the screens down, but you know what, Dominique, like it seems like you already have like an idea, but first and foremost, like find a PCP, a doctor that you can connect with. Remember that doctors are not there to like be your friends. They're there to like assess you medically, right? And tell you what they see, right? So sometimes we're not always going to hear what we want to hear from them, but that's the hard, conversation. So you want to make sure that you're comfortable with your doctor, that you feel that they are listening to your concerns so that they can help guide your treatment going forward. And definitely use like dietitian, nutritionists, use those resources that's covered by your health insurance for sure.
Mm. Thanks.
You're welcome.
Yeah, another comments. Carol says also check the naturopathic and homeopathic doctors.
Yep.
Also check for anything and everything.
Yes.
So
and they mix like Eastern and Western medicine too. Like they have a nice balance of the two. Like the Eastern and Western philosophies kind of, you know, where they can intersect where it makes sense for the individual patient. But again, it's finding that those healthcare professionals in your team that you feel comfortable with so that they can move you forward to really address any type of underlying issue that may be arising.
Okay, that's it. No other comments, and we are 10 minutes over an hour, but that's okay. Great conversation. Thank you all so much for joining us, and please take care.
Thank you.
Bye.
Bye, everyone.
Guys.
Bye. Thank you so much.
You're welcome.